I am Dr. Asaf Qadeer, Assistant Professor of Baylor College of Medicine and Lead Board of Trustee Director, Sarwar Shahida Trust Hospital in United States of America. This hospital is launched to serve the underserved community of Gujranwala and surrounding communities. Construction of Sarwar Shahida Cardiovascular Research Hospital has already started. We are building a hospital that will bring hope, treatment, and life to the poor families of Gujranwala. Please donate a brick, save a heart. One brick costs only 700 Pakistani rupees. 1,000 brick will cost $2,500. Be a part of this life-changing project. Together we can build a healthier future for Gujranwala. The first soft launch event was held on November 22nd in Houston, Texas, United States of America, where prominent physician community leaders and supporters gathered to endorse the mission and the commitment of its success.
सबसे पहले तो मैं आप सबका शुक्रिया अदा करना चाहता हूँ कि आप तशरीफ़ लाए। मैं ज़िंदगी में सिर्फ एक ही चैरिटी में हमेशा काम किया है, वो ज़िंदगी ट्रस्ट में जो शहजाद रॉय की है। ये दूसरी ट्रस्ट है जो कि मेडिसिन में है और इसका ताल्लुक कार्डिक हॉस्पिटल से है। आप जानते हैं कि अगर आपको दिल का दौरा पड़े, अगर 30 मिनट्स में आप अस्पताल ना पहुँचें और आपकी कार्डियक ऐत ना हो तो आपका हार्ट मसल जो है वो डेड हो जाता है। तो क्लोजेस्ट जो हॉस्पिटल है गुजरांवाले के या लाहौर है या सियालकोट, और वहाँ जाने में घंटे से ज़्यादा लग जाता है, जिसमें हमारी स्टैटिस्टिक के मुताबिक ज़्यादातर लोग मर जाते हैं या उनका मसल हार्ट डेड हो जाता है। तो ये बहुत ज़रूरी है कि गरीबों के लिए जिनके पास कोई सहूलत नहीं है, गुजरांवाला में ये अस्पताल हो। और मैं जब लाहौर में था तो अब्बास ताबिश साहब ने मुझे कहा कि आप इनकी हेल्प करें। फिर मुजीबुर रहमान शामी साहब ने कहा, तो ये मैं ज़िंदगी में मैंने दूसरी दफ़ा हामी भरी है कि मैं इस अस्पताल के लिए और पाकिस्तान की अवाम के लिए कि उनका जो मॉडल है महमूद और इजाज़ का कि गरीब और अमीर दोनों का इलाज होना चाहिए एक ही कमरे के अंदर एक जैसा। तो मैं समझता हूँ कि ये मैंने ज़िम्मा उठाया है। इसकी एक बोर्ड ऑफ ट्रस्टी हमने लिया है सैन फ्रांसिस्को से, और थर्ड बोर्ड ऑफ ट्रस्टी के लिए मैं 4-5 लोगों से रिक्वेस्ट मैंने किया, उनका इंटरव्यू कर रहा हूँ। तो इंशाल्लाह ताला दिस इज़ अ सॉफ्ट लॉन्च टुडे, तो इसके बारे में आप सुनेंगे और मैं आपको पूरी इन्फॉर्मेशन दूंगा। अगर आपने इसके लिए डोनेट करना है तो एक ब्रिक आप $700 की दे सकते हैं, चाहे आप थोड़ा दें या ज़्यादा दें, लेकिन दिल खोल के दें कि ये अस्पताल दिल के लिए बन रहा है। शुक्रिया।
We will talk to the other board of trustee today about this noble cause which Dr. Shoaib has taken and has been working on it for some time.
Assalamu alaikum. My name is Dr. Ahmed Ijaz Shah. I'm a practicing cardiologist in California, United States. It is my pleasure to be associated as a board of trustee member of the Sarwar Shahida Cardiovascular Care Hospital. As we all know, cardiovascular care is essential in a place like Pakistan, where a majority of deaths happen because of heart attacks. It is important in a place like Gujranwala to have quality cardiovascular care, and it is that gap that this institute will fulfill through quality care, not only for patients with heart attacks, but also for all other sorts of cardiovascular care.
Ladies and gentlemen, we are honored that today in our studio, Dr. Ahmed Ijaz Shah, who is an interventional cardiologist, assistant professor in cardiology from San Francisco, is here with us, who has recently accepted the role as a board of trustee director of the Sarwar Shahida Research Institute of Cardiovascular Science Trust. Thank you, Dr. Shah, for joining us. Would you share with our audience what is the need for a specialized cardiovascular hospital in Gujranwala?
Thank you very much, Dr. Qadeer. It's a pleasure to be here. I think it's important to understand that cardiovascular care and the burden of disease from cardiovascular diseases is very high, especially in places like Pakistan. And it remains one of the leading causes of death. So it is essential to have quality cardiovascular care available to people at the local community level, outside of the major metropolitan places like Islamabad, Lahore, or Karachi. And it is with that vision that the Sarwar Shahida Research Institute has been conceived, and it is hoped that in the coming years it will become a leading player in the provision of cardiovascular care, quality cardiovascular care to the people of Gujranwala.
Thank you. Would you share with our audience that what is cardiac care, what is cardiac parenteral care, how important it is, and what is the significance of bringing such a specialized care in Gujranwala and their community?
Well, quality cardiovascular care is multifaceted. It's not just the provision of the latest procedures or latest techniques. It has to be very comprehensive, starting from prevention, going to the general treatment of disease, as well as then ultimately if you need more invasive procedures or interventions or surgeries. So it's a big spectrum of care that's provided. And we hope that in the vicinity of Gujranwala, we will provide not only preventive care, but also quality care, which is called tertiary care in cardiovascular disease. So it has to be local engagement with the community and try to figure out how and what the needs of the people are and how we can address those needs. And then also provide a place where quality emergency care is available 24/7 to the population, especially for people who have heart attacks, for instance. They cannot travel the long distance to a quality hospital in Lahore. They need a care, some place close by, close to their homes where they can be brought in an emergency, because time matters in heart attacks or in other cardiovascular illnesses. The longer you wait, the greater the chance of death is. So we want something that is closer by to the home where the people live, some quality care that can be provided.
Dr. Shah, I met Dr. Shoaib Sarwar Hashmi, who himself is a accomplished cardiovascular doctor, as a cardiologist and an accomplished assistant professor there, who has started this pioneer work there. And my conversation led to a concept that he said that every room, the 200-bed hospital, will have one person who will not be paying, and the person who will be the other person with subsidized care, they both will get equivalent care. And he quoted, and I quote him, what Allama Iqbal said, कि एक ही सप में खड़े हो गए महमूद और याज, ना रहा बंदा ना बंदा नवाज. Essentially he's talking that he wants to uplift the poor people in Gujranwala and vicinity area who otherwise would not have a specialist care. How important it is to have a hospital in Gujranwala if you have an acute heart attack?
It is essential. I think if we are to ever provide quality care, and here specifically cardiovascular quality care, we have to have hospitals closer to where people live. And if that requires a number of hospitals throughout Pakistan, that's what's needed. But here specifically for Gujranwala, it is essential to have a place where people who are having a heart attack can be sent to in a very expeditious way, quickly, and we transfer there to get quality care. It's essential.
Yeah, what do you think if a person has a heart attack and if he needs a cardiac cath in a number of time, what do you think the significance of doing a quick procedure as opposed to Gujranwala people traveling to Sialkot or Lahore?
Yeah, to explain that, I can tell you what we have here in the United States, where if someone is having a particular kind of a heart attack, the time that they present to the hospital to the time that they end up getting their blocked artery open or the heart attack aborted is about 90 minutes. And the quicker you get to that blocked artery, the better it is. And many hospitals actually aim for a 60-minute time from the time that the patient presents to the emergency room to the time that we take them to the cath lab. Now, when we look at it from a bigger perspective of the community, the quicker we transfer a patient to the hospital, the quicker we can get that artery opened, which means the quicker we can save the heart and salvage the heart. Majority of heart attack patients die within the first 2 hours. So someone having a heart attack being transferred to, let's say, somewhere in Lahore, majority of that 2 hours will go, depending on traffic. So what you want is someone it can be taken closer to an emergency that's close by, and quickly and rapidly go to the procedure and get that blocked artery open.
Great. That's a good information. Dr. Shah, on the 22nd November, we had a soft launching about this Sarwar Shahida Research Institute of Cardiovascular Science Trust Hospital. And we made aware to all the doctors, all the community leaders about this upcoming hospital. And inshallah, we'll have a fundraising here in Houston. And I am very confident we will have another fundraising in San Francisco once we are established. This thing is fair footprints in United States of America. I have been to England. They are already established in UK. They are well established in Pakistan. I want your comments on that, about this soft launching of this institution in United States of America.
I think it's essential. We have examples of other major Pakistani charity hospitals and in organizations having fundraisers in the United States. They've done a great job. Pakistanis are generally very open-hearted, and it's important to tap into the resources of the overseas Pakistanis and see how they can help in this venture. There are a number of other organizations doing other great causes, but this too, I think, should rank amongst the top causes of the provision of quality cardiovascular care to those who it is not provided to before, to communities where the outreach with quality cardiovascular care is really urgently needed. So I think it's essential that we have these fundraisers in the United States. And anyone who learns about this, I would encourage them to look this up, do some research in the organization, and then look at what they're offering to the people of Pakistan, and how they can contribute, whether it's a small brick or if it's 1,000 bricks or if it's a whole room. Whatever they can do, they should be able to help out, and we'll really be grateful for that.
Thank you, Dr. Shah, for coming and talking about it. Inshallah, we both will work diligently and do all the justice by which some poor person in Gujranwala and Sydney area can have a quality heart care. Thank you for your comment.
Inshallah. Thank you very much.